So let's cover the 4 parts of Medicare. This way you'll discover not only is it fun and exciting, but easy to understand. Now that's sarcasm because Medicare is so confusing. You have to learn the 4 major components of Medicare so you operate from a position of knowledge and avoid ignorance of a subject which is important, your health. So let's approach Medicare enrollment. It's crucial to grasp there's 4 primary components of this program. Parts A, B, C, and D. The complexity of Medicare can be overwhelming, so let's keep it nice and simple. It starts with parts A and B. These 2 parts constitute what's considered traditional Medicare or original Medicare, as they've been in existence since the program's inception. Medicare Part A provides hospital insurance for coverage for inpatient hospital stays, care nursing facilities, hospice care, and home health care. For most individuals who have lived and worked in the United States for 10 years or 40 quarters, Part A is premium free, which means you don't pay a penny. However, it's crucial to note that Part A doesn't cover long-term custodial care in nursing homes. Deductibles and coinsurance apply if you lack supplemental insurance coverage. In 2023, Medicare Part A deductible stands at $1,600 for every 60-day benefit period. Medicare Part B covers medical services, including doctor's office and visits, diagnostic testing, ambulance services, and more. Now, it's not premium free. Its standard premium in 2023 is $164.90, and that's going to probably go higher if you make more money because there's a tax called IRMA. Additionally, Part B comes with a $226 deductible per calendar year, after which it covers 80% of all your medical expenses, leaving you responsible only for the remainder. Now, you are generally eligible for original Medicare on the first day of the month once you turn 65, with a 7-month enrollment period starting from 3 months before your birth month, extending 3 months after. And oh yeah, if you like this video, press the like button. It helps boost videos like this up the algorithm and helps me make more great stuff just like this. And don't worry, there's no test at the end, because now we're going to Medicare Part C. Medicare Advantage. Now, Medicare Part C, also known as Medicare Advantage, is an optional part of Medicare offered by private insurance companies in collaboration with the government. It provides an alternative way to receive your original Medicare benefits through managed care plans such as an HMO or a PPO. To enroll in Medicare Advantage plan, you must have enrolled in Medicare Parts A and B and continue to pay that Part B, which just keeps sucking out those checks. Now, these plans cover the same services as traditional Medicare in a slightly different way, but for the most part, the same thing. But each plan sets its own cost-sharing requirements, co-pays, and co-insurance amounts. Medicare Advantage plans typically work with a network of doctors and offer additional benefits like dental, vision, hearing, which is typically not covered in traditional Medicare. Now, I cover the differences between original Medicare with a Medicare supplement in advance and Medicare Advantage and the differences between them in a different video. We're not going to cover that right now. Medicare Part D is your prescription drug coverage provided by a private insurance company approved by the federal government. Now, you can obtain your Part D benefits through a standalone Medicare D drug plan, or in most cases, when you get a Medicare Advantage plan, it comes with a Part D plan. It's up to you. Part D plans vary in the medication they cover and the costs associated with them. And this is the biggest thing. You need to shop this out, especially if you're on a lot of prescriptions. The least expensive Part D plans cover the most generic and brand name medications. Now, Part D covers things like vaccines, like the shingles shot, which are not covered by your Part B coverage. So to avoid lifelong Part D late enrollment penalties, it's essential to enroll in Part D drug plans if you don't have other credible prescription coverage, because when you look at the penalty year over year, it can actually make your Part D coverage almost unaffordable unless you enroll at the right age. Now, you have to weigh your options. As you're approaching Medicare eligibility, you'll encounter numerous ads and commercials talking about the best things out there. Oh, everything's free. Now, these plans generally fall into 2 categories. One is Medicare Supplement, which has a premium that's more than $0, and Medicare Advantage, which always talks about $0 premiums, get free, free, free. Now, each option has its pros and cons, and the best plan will depend on various factors that I just can't cover in this video. But I will say, if you're considering the differences, you should know how they work in a way that is personalized just to you. Because it's impossible to know what is right for you just by watching a video like this. You need someone who understands those pitfalls, because making the wrong decision can actually be something you may not be able to get out of, especially if you're in a state that requires underwriting. And that can even change from county to county. It's crazy. And that's why it's important for you to have an agent who can give you personalized advice. So if you see a number on the screen, you can call it or click the link down below and book a call. It's really just that simple. But although it's really important for the difference between these 4 big parts of Medicare, which I didn't test you on, don't worry, we're going to go through the difference between Medicare Advantage and Medicare Supplement, which is vital to know which one to choose, because if you don't, it can have massive, massive impacts on your life.